Christian, set us up here. What's going on? Government shutdown's over. Yes. Should we all be celebrating? What's next?
So this is a very complicated situation. So to kind of set the stage here, 2020, for those of you that have been in the business that long, if your professional lives are that old, some of you are, but not all of you, they introduced additional ACA subsidies to combat COVID. Okay. I can't believe we're talking about COVID in 2025, almost 2026, but here we are. We're talking about COVID. So these subsidies made it possible for people that never would have qualified for a subsidy before to qualify for one. And this has been going on for 5 years now that these subsidies have been available. We've seen clients that make $100,000 a year, $125,000 a year. And they're like, I'd never qualify for a subsidy. Never say never, John. You know, True. $100,000 a year, half his premiums paid for. He's like, huh? He's like, so the government's going to help me? I'm like, yeah. He's like, why? I'm like, they're dumb. Let's do it, John. Let's do it. Let's take advantage.
This is all true.
And so subsidies just wild, extended all the way up until now. Now, part of the Inflation Reduction Act in 2022 extended these subsidies longer. So that has a bit to do with how these continued going. It's not like they just, flipped the switch in 2020 and then they're like, see you in 2026. And then they, turn the light off. They leave the subsidy in a room.
Take a second here. Maybe break it down for someone who really doesn't understand ACA. Maybe explain exactly what that subsidy, what that looks like.
Yes.
I know some of this. Like, for example, maybe someone's listening to this and they're like, "Oh, does that money go to me, or where's that money go?"
Yeah. So if you're not familiar with ACA, when there's a premium subsidy happening, it's essentially that a subsidy is going to the carrier to help pay a portion of that person's premium, and in some cases, their entire premium, if they're in the proper federal poverty level percentile, right?
Right.
And so that's essentially what it is. It goes directly to the insurance company, it goes directly to the carrier, which there's been some wild kind of ideas passed around about that changing, which we're going to talk about on today's show.
Right.
And so, but anyway, that's how the subsidies work. Now, these subsidies have been rich, and there's a lot of people that kind of rode the wave a little bit the last couple of years of these increased subsidies and taking advantage of, hey, I mean, somebody that makes 60, 70 grand a year in America is probably considered middle income, middle class income. And they're getting substantial premium subsidies as if they were somebody that was on food stamps almost, Granted, you can't get on ACA if you're on Medicaid, but you guys get the point, right? So That's a little bit of like what's gone on. Now, there's a lot of things that have had to do with this government shutdown, and kind of depending on which side you support, which cult you're a part of. Because that's kind of what this is, two cults debating on what God to worship.
That's very accurate. Very accurate, actually.
But depending on which of the two cults in government that you're a part of, you might have differing opinions on what the shutdown actually has to do about it. It's kind of interesting. It's kind of interesting how many different opinions there are on what the shutdown's actually about. And to be fair, there's a lot of things that make up, kind of what it actually entails. But part of it is pulling back these subsidies and putting them back more to what they were like pre-COVID in 2019. Whereas at that point in time, if you were making $100,000 a year, you're not going to qualify for a subsidy. And the truth is you probably shouldn't, and so that's a big part of it. So the government, anyway, that's almost like setting the stage. That's a portion of what this government shutdown has had to do with. The Democrats have wanted to extend these subsidies. The The Republicans have wanted to pull back these subsidies. Certain elements of the Republican Party, including the president, have wanted to just completely get rid of the Affordable Care Act altogether and throw the baby out with the bathwater. And we'll talk about that. But yeah, so the government shutdown comes to an end, but that's almost like essentially like what's been going on leading up until this point. Where do we want to go from there? Do we want to go into?
So I have a video I want to share that kind of highlights where we're at right now. Just like 3 minutes that I think is interesting. The other thing I wanted to mention too is the compromise that ended up happening that ultimately led to the end of the shutdown. I think this is important to mention because this is directly related to ACA and these subsidies that we're talking about. Essentially, the Democrats said, hey, we'll go ahead and agree to move forward without these subsidies now, but you have to promise you'll vote on it later. Which my understanding is that they don't even necessarily have to vote on it later. Like there's no official mechanism that's going to legally hold them to forcing them. So maybe we don't even have another vote on these subsidies later. It sounds like it might not even happen. But what's important to understand is that as of now, legally, these subsidies are gone.
Yes.
What we were seeing towards the end of the shutdown, as November 1st rolled around and ACA open enrollment started, there was kind of this shock factor among consumers and agents and brokers alike, where people were looking at some of their premiums and they're just like, what? Like, what is going on?
Yeah.
Okay, so that being said, let me share my screen and I'll share this quick little clip. Probably just watch like 2 or 3 minutes of this, and then we'll continue this. We'll kind of see where we go. All right. Can you see my screen, good sir?
I can.
This is an issue of right and wrong and trust in government. I thank you, and I yield back the balance of my time.
Thank you, Ms. Bonamici. Ms. Ansari, you're recognized.
Thank you, Madam Chair. Welcome back from your 8 weeks of taxpayer-funded vacation. It's good to see you, and I hope—
I'm going to interrupt you. I'm going to interrupt you, please. I am sick and tired of hearing you all say we had an 8-week vacation.
That's exactly what happened.
I worked every day. I know about you. I don't want to
worked
hear
every single
another
day as
soul
well. We all
say
worked
that.
every single day, and that's exactly what happened with Speaker Mike Johnson.
You're recognized.
I hope that you all enjoyed yourselves while American families looked at their letters from their health insurance companies, terrified that their insurance premiums were going to double or triple while the House was out of session for 53 days. That is unacceptable, Madam Chair. Now, we are back here to vote on a terrible partisan spending bill that will deepen a healthcare crisis that you did create. By first stripping away Medicaid from 15 million people. That is a fact. I'm sorry that you deny that fact, but that is a fact of the matter in the bill. And by refusing now to extend the Affordable Care Act, healthcare premium subsidies that keep coverage affordable for American families. And you also did all of this while engineering the most unprecedented transfer of wealth from the working class and poor Americans to the wealthiest people in this country. That is another fact. The Republican shutdown lasted 41 days. It is the longest shutdown in American history. 41 days of unpaid federal workers and families losing access to food assistance. 41 days of families skipping meals and seniors delaying care because Donald Trump chose to use hunger and healthcare as leverage. The callousness and corruption is astounding.
All right, we can stop there. But I liked that clip because I feel like it kind of set the stage for where we're at. And also just the venom between both sides that we're dealing with right now. I mean,
yeah,
on both ends of it, they both were so pissed. So pissed.
That clip was extremely entertaining. I have people that comment on my posts on my personal page every single day And even if I post something that has nothing to do with what's going on in government or politics, I could be like, I love cotton candy. How about you guys? They would just comment as if I said, I love Trump's cotton candy hair. What about you guys? It's like, so it's just like inserting it into every single thing that
they
that
gotta
happens.
bring it back. Yeah.
So that I say that to say to your point, the temperature, it's like 110 right now. The thermostat is it's about to break.
It's unbearable. It's unlivable. So I think this is a pretty complex situation that we've kind of painted ourselves into the corner of, this whole subsidies situation. That's, do I agree that COVID subsidies should have ended a long time ago? Yeah, they probably should have, like you said. I think it's a pretty complex problem, though, because the cost of healthcare and the cost of these premiums has skyrocketed, and to the point where a lot of Americans now are having to look at their budget and say, can I actually pay this? Or am I going to have to kind of just toss this out entirely because, I can't afford it?
There's a lot of aspects to this that we need to jump into and we need to break down.
Yeah.
I'll lay out the ones I'm thinking of. Tell me if I miss any, and then let's decide which direction we want to go. Okay. So number one, maybe we just start here. All right. If that works for you. So let's talk about this, right? So premiums are skyrocketing, even without the subsidies being taken away, right? Just regular, the total premium that someone would be paying is going up substantially in many places and on many plans. The question becomes, why is this happening? And I think the biggest answer to that is it's the same reason why the cost of all plans is kind of skyrocketing, right? Med sup premiums are spiking.
Right.
Medicare Advantage plans are seeing Medicare Advantage. It's a bit of a more complex issue, I feel like, because we've talked about this in nauseating detail. I don't want to talk about it today, but it's the rising cost of medical care. And this is what so many people don't understand. They see their health insurance premium go up, the average person that's not in the insurance business, and they'll be like, greedy insurance companies to feed their fat face. They picture like this huge obese insurance carrier executive, and he's like,
Jabba the Hutt.
Yeah.
Jabba the Hutt. Yeah.
And it's like,
you're totally right.
They're like, excuse me, Mr. CEO. The members are upset about the premium increases.
We talked on the show before about kind of the PR nightmare that a lot of these carriers have to deal with, right? It is this stereotypical like insurance executive. Like there's like a visceral reaction that the average person has to that phrase, insurance executive, right? There is something to it where they just think there's pure greed at the top. And now, mind you, there are shareholders and there is some corporate greed happening. I'm not going to deny that that's not a factor, but I think the reality is it's inflation and it's the cost of healthcare. I really think that's got to be number one here, right? For these premiums going up. And if you're like, well, maybe that's true, Glenn, but it's not that much. Go to the grocery store. Look how much inflation. When it slowly cranks up the heat month over month, you don't really feel it or see it or think about it too much. But if you go back 3, 4, 5 years, go to 2019 and look at how much the cost has increased on goods and services, and healthcare is just, and not only that, but I believe the stat is healthcare supersedes the normal inflation as far as the increase in cost. So we already know inflation over the past 4 or 5 years has been significant. Healthcare inflation stereotypically will rise even faster. Mm-hmm. And then you also have the usage of insurance going up as well with an aging population, right?
Yeah.
Obviously 65 plus is on Medicare, but what about the 50 to 65, right?
Sure.
kind of the younger baby boomer demo, they're utilizing more insurance than ever as well. That's what I've read. So
It's a simple economics conversation to where
yeah,
if it costs more to get medical care, the cost to cover that medical care has to go up. It's one domino falls, it's going to hit the other domino. That other domino is not just going to sit there. It's going to fall too. And, you know,
sound like a rotary phone.
but but yeah, so like that's a big piece of this puzzle. Now,
yeah,
I don't want to get, I'm not, I promise I'm not getting political with this. I'm not trying to, I'm not going to.
that's
Not that I'm not,
but this is also this is the intersection we're at, though, right? Is like not only did these subsidies go away, but these premiums were going up no matter what, right? So
Yeah.
you have the premiums rising plus the subsidies going away. That's what's creating this crazy gap, right?
well, here's where I'm going with this, right?
Okay.
There's a question that needs to be asked that hasn't been asked for 15 years. Because how long has ACA been in place as law?
2009?
Yeah, 15 years, 16 years, something like that,
Yeah.
17 years. Does the model work? Does the model work from the beginning? The model from the beginning, we've talked about this on the show, was no health questions. Everybody has to have guaranteed acceptance. Pricing becomes unaffordable. Well, the way that was fixed is subsidies started coming from the government, but that's unaffordable from the government's perspective, right? That adds a huge amount to our deficit. It's never been a really great setup, in my opinion. I don't know if any of the audience would agree with that, but it's like, this is going to sound horrible. Was it better before? Because before, if someone was healthy, they could get a lower premium. If someone was unhealthy, they could be put in a different rate class. I don't know. I don't know the answer to that. It was definitely more sustainable from the insurance company's perspective. Now, the insurance companies had a lot more power to kind of do whatever they wanted. So from that perspective, it's probably wasn't better. It was probably worse. But this kind of leads me into this next part of the conversation. There's a lot of conversations happening now that the ACA, the Affordable Care Act, needs to be repealed and replaced. Trump ran on this his first time running for president. Just nothing ever really happened with it. But he's talking about it a lot now. He's floating
the concepts of a plan, right? That was the
Yes.
first term. Right? I have concepts of a plan.
I shared on my personal page a screenshot of something he posted on True Social, and he's talked about it many times since. So like, there's people saying that, oh, he doesn't really mean that. He's using it for political leverage. But then the shutdown ends. He's still talking about it. So no, I don't think so. I think it's actually like what he thinks he needs to be done. But essentially the concept that he put out there was the insurance companies are evil and bad and screw them. And instead of sending subsidy money to them, that's literally more or less what he said.
I know. It's just crazy to hear that.
And
the United
instead of
States president is like, screw the insurance carriers. Like,
yeah. And
like, what?
he's posting charts of like how big all these carriers are and their stock price. Like it's crazy if you've been following it. So his idea is, let's take this subsidy money and send it to the people, and then they can give it to the carriers.
People.
So I'm like, okay, instead of giving it directly to the carriers, let's give it to you, little Billy, so you can give it to the carrier. Like,
and that solves the problem. And it would be less than most subsidies, right? Because it sounds like It's a
If you do the math on
one-time
it.
payment. Yeah. So we're going to give the money to the people. We're going to give them a lot less than what they were getting through the subsidy. And this is going to solve the problem. And then it also circles back to this weird, it's like, if the insurance companies are so greedy, why would you give us money to then just turn around to give to them? How is this solving the problem in any way? It doesn't. I don't understand the line of thinking at all.
Well, what
it
I
does
said,
beg the question, though, what should the system look like, right?
yes, and that to me is the bigger question, because if we can acknowledge that there's an issue with ACA, and the only way to solve the issue is to dump piles of money on it, which I don't think is sustainable long term, right? What does the system have to look like? And that's the tricky part of this. I made the comment about what Trump had said. Again, I'm not trying to be political, but like I made the comment that like him talking about it in this way just shows that he doesn't know anything about insurance, like absolutely, positively nothing. And we already knew that.
Couldn't agree more.
Right? Like, in his
Couldn't
first term,
agree
I told
more.
the story about, he did this like speech about how great Medicare Advantage was, because they were trying to expand Medicare Advantage. And he brings up seniors to talk about how great their Medicare Advantage plans are. And every person he brought up had a Meds Up, and he didn't know the difference.
I remember that. Yeah.
So like the person goes up, he's like, I had no copays, no deductibles, no out of pocket. It was great. And Trump's like, how about that? No out of pocket, great Medicare Advantage plans. And like, I'm sitting there, I'm like, he has an F. He has a plan F. I'm like, I'm screaming at my screen, and but like,
I need to get the White House on the phone right now. This needs to be corrected. This needs to be corrected. Oh my God.
But yeah, I mean, like, it's always been an issue with ACA, is my point, for 15, 16 years. The only reason it ever got to a point where it was maybe even looked at as a little bit more lucrative for the carriers to be in this business, it's been, feasible for Americans to buy these plans, is when they just dumped piles and piles of money to subsidize it on top of it. But is that the long-term viable solution or the answer for that program? I don't know. I mean, so I guess that probably not is my answer.
So there's a couple. I mean, we could speculate on some systems that might work better, and I have a couple things I'd like to say about that. But there's a comment here from Michelle. She says, "What's the prediction for how many people will go uninsured?" Guys, Freebie Friday is happening today. Today, it's Friday. I know it's that point in AEP where you wake up and you look out the window and you're not sure where you are or what time of day it is. It's just a goulash right now, and I couldn't agree more. But it is Friday. If you didn't realize that, happy Friday. Freebie Friday is happening. We will be giving away tickets to the summit. I don't know how many yet, but if you comment on either today's stream or Monday's stream, you will get entered into our giveaway, and that will be announced later this afternoon. So comment below, tell us your thoughts, tell us what you're thinking, #Team Replay if you're watching the replay of this. But yeah, back to Michelle's question, what's the prediction of how many people go uninsured? If things stay the same and these subsidies don't come back, which, just like you told the team internally yesterday, I couldn't agree with your messaging to the internal team yesterday more. It was just like, listen, guys, I know everyone's in shock with what's going on. And a lot of us want to kind of wait around, be like, oh, don't worry, we'll get these subsidies back later. But the reality is this probably won't come back, at least for now. It looks like it's gone at the moment. So operating any other way would probably not be likely. So how does that going to affect, the under 65 health space?
The other thing that's weird about this, we kind of talked about this earlier already, but and I want to circle back to Michelle's question, but like the idea is they're going to come back and vote on this subsidy issue in December. Well, by then it's too late. You know what I mean?
It's like December 18th, they're voting. It's like, what?
Yeah, like
what?
it's what is
over?
Like you have ACA open enrollment that goes till December 15th. All of November, people are enrolling into plans, trying to make preparations for their plan for next year.
They don't even understand that though. They probably don't even realize they're like, oh, they only get to sign up until December 1st. Like,
December 15th.
Like
December 15th.
Right, December 15th. Right. That's what I meant.
But yeah, anyway, that's a big part of this. Like this no matter what the system looks like, I believe that the government should regulate it, because otherwise I think it's possible for insurance carriers to kind of, manipulate things in a really bad way, which we've seen historically in history. I'm not against there being regulation and barriers put into place, but I think anytime you take the insurance and you put it too heavily into the hands of the government, the more fucked up it's going to be, because the government doesn't understand insurance. How can they solve a problem they don't understand?
They can't. Yeah, they can't. So what do you think about the number of uninsured individuals going into 2026? What are your thoughts on that?
I don't have an exact number for you, but I think it will be a record high, a record margin of people will be uninsured.
What would you guess? Maybe we could even like ask ChatGPT or Google this, but what was last year's numbers percentage wise? Would you guess?
I have no idea. I actually don't know. That's a great question. Let's ask Chatty G.
Yeah, ask Chatty G.
Hang on.
I'd like to know because.
Hang
all
on,
right, here we go. Christian's best friend, you guys.
So tell me this: how many people went uninsured in America in 2025 or 2024? Either year is fine. Thank you.
Sure. So for a bit of perspective, around 2024, roughly 7.9% of Americans, about 26 million people, were uninsured. And that was pretty steady from the year before. But looking ahead into 2025, it's expected that maybe up to 4 million more people could end up uninsured if certain subsidies expire. So that's the ballpark we're talking about.
So tell me this, for 2026, it's going to be a uber amount more people, right? Like gobs of more people.
Well, goobs and gobs is a pretty colorful way to put it. But realistically, it's a bit early to say for 2026. If the subsidies and policy landscape stay stable, the number might not explode. But if things change, say some of those supports do run out, then yeah, we could see a noticeable jump. It's not guaranteed to be gobs more, but it's definitely a possibility if policies shift.
We could stop having you flirt with AI on the show. I don't know if I can handle.
What if we did a second pod? What if we did a second pod and my co-host was not? That was my co-host.
You know what I'm thinking about? I'm thinking about the Wilson ad you're wanting to do. I think you got to tape your phone to the volleyball, and you're talking to AI. So 26 million was the number Chatty G gave us. With these subsidies being gone and the premium, which I want to talk about the actual numbers behind this premium hike really fast too. KFF had a study that said, which is Kaiser Family Foundation. Dr. Mehmet Oz behind me, CMS admin, he denied this study to be real. From what I've seen and read, it's a real study. So I don't know. He slammed it down so fast.
Wow.
And he's like, that got retracted. That got retracted. That's not a real study. But they said that the national average premium increase is about 115%. So you're looking at a doubling.
Wow, that's a huge number.
115%. Is what the between the subsidy loss and the premium increases. That's what the average American's looking at paying more. So you're talking about a huge amount. So to really finally circle back here to Michelle's question, like how many people are going to go uninsured? I mean, I wouldn't be surprised if we see that number almost double, right? I mean, we could be looking at 40 million Americans going without health insurance in 2026, which is a crazy huge number. I mean, you're talking about more than 10%, more than 1 out of 10 Americans not having health insurance is crazy.
Can I just mention something?
Please.
We are going to see a return and a surge of short-term medical plans. The return.
Oh!
The prodigal son returns. All states like, like there's like a sun coming up behind it. Manhattan Life, affordable choice, guys. You need to have this in your tool bag. If you don't, reach out to us. We can get you hooked up with the contract. But yeah, I mean, there was a time there before the ACA subsidies got crazy that for us anyway, in our office, we were probably doing just as many short-term medical plans as we were doing ACA plans because the premiums were so much lower. And for people that were healthy and wealthy is what I would call them, the healthy and wealthy crowd, they were great alternatives. And the reason why I say healthy is because those plans natively have limitations in their coverage, right? They don't cover pre-existing conditions. They don't cover a lot of preventative care. They don't cover like cancer and stuff like that. They have limitations, but they're more like catastrophic coverage. But they would be like half, if not a third of the premium of an ACA plan without a subsidy. And if someone didn't qualify for a subsidy, which far less people are, it was a really viable option. We were seeing a boom in those types of plans. The Biden administration kind of kneecapped them because you could get a plan for 24 months, essentially, in some places more. And they would be like, the Biden administration was like, oh, you can only get it for 3 months. Screw these plans. Like they went on the offensive, right?
Yeah.
Well, that's been kind of taken back now. I believe the Trump administration undid that, and now you can get 24 months of coverage again. So to me, I think it's going to go back to what it was circa 2018, 2019, where like ACA is there if you can get a subsidy, if you have health problems, things like that. But a lot of people might need to be thinking about these ACA alternatives. Like we were already kind of living in this world before.
I couldn't agree with you more. I could see where if you're in a situation where you can't afford a premium, but you still need something, you might want something like a catastrophic plan. I bet Medishare, whether you love it or hate it, no matter what side of the spectrum you're on with like the Christian Medishare programs, right? I wouldn't be surprised to see that take off in a big way because a lot of times those are a cheaper alternative, not really insurance, but it's something that people turn to. I did find the article. I wanted to show this really fast. So I have my receipts here on this because I thought this was really interesting. I saw the news clip where Dr. Oz was a reporter basically quotes this article from KFF and just immediately he's like, no, that got retracted. It did not get retracted. It did not get retracted. So this is the tax credits that are going away, right? That we talked about. So, the 400%. And here's the exact line. In other words, expiration of enhanced premium tax credits is estimated to more than double what subsidized enrollees currently pay for annual premiums, a 114% increase from the average of $888 in 2025 to $1,904 in 2026. I think one thing to keep in mind with this too, because I've seen people pulling out all sorts of different numbers and quotes, like it's not going to be the same for everybody everywhere. So some people might see a little bit of an increase. Some people might be seeing an increase even bigger than this, right? Obviously, if you have a lot of dependents too, like that can change as well. But there it is. Like that's what we're talking about today on the show. It's right here. This is what we're dealing with. We are driving off this cliff and into this wall here. So I don't know what else. I don't know what else to say. Like, I guess that's our thumbnail right here. This is the
that image right there. Yeah,
for the video.
that's gotta be. That's got it. That is so bananas. Yeah, I mean,
Yeah.
that is really what I think is where we're headed, right? Like, again, my team was doing 2019, and back then a lot of it was me producing it because I was still writing a lot of business back then. We were doing just as much of these ACA alternatives as we were ACA plans. It was probably like 50-50. And guys, those short-term medical plans, they pay freaking ridiculously well.
And guess what the compliance behind those are? It's not a
There are,
Medicare
Teddy.
Advantage plan. It's not a Medicare Advantage plan. I'll tell you that much.
Nope. No scopes over here.
I love how you turned into Mr. Krabs the second I got brought up. You're like, whoa. You're like, there is no compliance.
No compliance. Hang on.
I like money.
Hang on. I'm gonna find it. Okay, you ready?
Yeah.
First of all, congratulations, Mr. Krabs.
Hello, I like money.
What inspired you to build a second Krusty Krab right next door to the original?
Oh, here we go.
Money.
I actually, I know some call centers that did really, really well selling
Me
the
too.
short-term
Me
medical.
too. Yeah.
So it's a real product. And it was one of those things where it was so nichey. And with the ACA, you know, some of these tax credits that were in place, the premium credits, it didn't really make sense financially. But now we're in a completely opposite world where those short-term medical plans might be a really great solution for people. So yeah, that's, you know, I don't know if you want to spend.
I'm sorry. I didn't mean to cut you off. I just wanted to like mention too, like Manhattan Life Affordable Choice, you guys, is another great option, right? Like it's, for those of you that aren't familiar, it's like a super indemnity product. You know what I mean? Like it probably isn't the most ideal product to be standalone insurance policy, but you could put it with even a short-term medical plan, have them both together, and it'd probably be way cheaper than a normal ACA plan without a subsidy. Like, and it will
Better
pay
than no coverage.
Yeah. And what I always found when we were selling a lot of short-term medical plans is like, you can pair a cancer plan with it. You can pair a hospital indemnity with it, an affordable choice with it, something like that. And it's still going to be substantially cheaper than the ACA plan, right? Like the bundling opportunities are real. And it's also probably irresponsible not to bundle because those plans have the limitations, right? I think I first picked up my own cancer plan because I had myself on a short-term medical plan because I didn't want to pay the freaking ACA premiums. You know, and so, yeah, I mean, I just feel like everyone's used to the past 5 years of this probably ACA golden age in a way from the subsidy standpoint and from an agent's point of view. It's going back to the way it was before is the way kind of I'm looking at this. I mean, it's premiums are higher than they were back then for sure. But like, I'm just saying it's not going to make sense for probably more people than it ever has before. So these alternatives are kind of shifting back into the mainstream conversation.
It's one of those things where it's like, I don't know what you thought would happen after extending these subsidies out for so long. Like it's similar to when they put a hold on everyone's student loan payments. They're like, you guys don't have to pay student. Like, obviously by the time you turn those back on, it's going to be some people that just like won't pay them. You know, it's like, it's just kind of that same situation where, you know, I don't know what the government thought would happen. Oh, we're going to temporarily do this for 5 years. You know, it's like, well, here we are, you know, and that paired with inflation. So I don't know if you know, we're coming up, we have about 10 minutes left here. So I don't know if you want to speculate on what could be a better system. I don't know if you want to talk a bit more about how agents can navigate some of this going into Q1 of next year or end of this year, you know, with open enrollment being right now. I mean, kind of up to you.
I think the navigation part is the much easier conversation. And I think we've covered it already a bit. Like, I think you can't do anything about it as an agent in terms of the premium subsidies and everything like that. All you can do is try to offer the best plan to your client. But my message would be for people that fit the mold, ACA alternative plans, that's probably going to be the saving grace for a lot of you guys.